Good afternoon, everybody. I am Dr. Sushin Dutt, Senior Consultant ENT, Sinus, Skull Base, and Cochlear Implant Surgeon at Fortis Hospitals, Bangalore. It's great to be on this webinar today. So, today we are going to discuss about one of the most commonly encountered ear, nose, throat, the ENT problem, that is nose block. So, nose block is not new to us. Every once in a while, most of us catch a cold, most of us have nose plugs, we catch a fever, we catch a flu, and most of us also go for over the counter medication. The topic in specific for today's discussion is septal, septoturbinoplasty and sinus surgery. So, what is the nasal septum? Nasal septum is a wall which separates the two nostrils. So all of us have right and left nostrils. We have a wall, a partitioning wall, which is called as the nasal septum. The nasal septum is partially composed of bone and partially composed of cartilage. So it is a bony cartilaginous union which forms the nasal septum or the partitioning wall. In the Indian population, approximately 90% of us have nasal septal deviation. That means to say, the wall, which is ideally meant to be straight, is either deviated to the right or the left side. But not all 90% of these people that have deviations have symptoms. So when a person comes with persistent symptoms of nose block, especially if it is one-sided or uninostril or unilateral, that is when the ENT consultant steps in. So it is common to encounter nose block on the side of the deviation, meaning to say, if a person has persistent nose block to the right side, there is a good chance that the partitioning wall or the nasal septum is deviated or bent to the right. Why do these deviations happen? These deviations are not a disease, they are developmental in origin. When the bones of the nasal skeleton grow, there are pieces of cartilage, pieces of bone fighting for their space in the nasal cavity. When any one of them outgrows the other, since I said there is one cartilage and two bones which form the nasal septum, if one or two of the above structures override in growth in comparison to the other two, there tends to be a buckling, meaning to say the wall tends to move away from the midline. That is when the wall gets deviated to one side, that is the right or the left. So when a patient has persistent nose block, he seeks an ENT consultation. The first thing that we do after a detailed history taking is a nasal endoscopy. A nasal endoscopy is basically a video examination of the nasal space wherein we pass a small 4 millimeter rigid camera with an endoscope into the nasal space to look for the alignment of the nasal wall of the septum. See, it is the septal deviation is easily picked up on nasal endoscopy. Apart from the nasal septal deviation, we can diagnose conditions such as nasal polyps, turbinate enlargement, sinus obstructions on endoscopy. So, what is a turbinate bone? A turbinate is a spongy structure present in both right and left nasal cavities. There are three pairs of turbinate bones inside each nostril. So, what happens when a person is in a cold environment? The turbinate bone is lined with a soft layer called as mucosa. It is a spongy tissue. This usually reacts or responds to the environmental conditions. When the climate or the environment is cold, the turbinates become more boggy. When it is dry, they tend to become less boggy. The turbinates have a role in regulating the amount of airflow from each nostril. So, along with the nasal septal deviation, having a turbinate enlargement, a turbinate bogginess is not so common. It's not so uncommon. So, when a person comes with nose blocks, not only do we look for the septal deviation, we look for what is called as the turbinate enlargement, which can be picked up on endoscopy. Similarly, we also look for polyps. What are polyps? Polyps are basically, you can simply call them as bags of water. They are the prolongation of the inner nasal skin. The inner nasal skin is called as the mucosa. When these become boggy or enlarged, they form small sacs. They can be single or multiple based on the cause of the polyposis. This condition is called as a polyp. What does a polyp do additionally? In addition to the nose block, if the polyps enlarge in size, they can lead to a reduction in smell and sometimes give a headache and a mouth breathing. Sometimes, what happens, apart from the septal deviation, turbinate enlargement, and polyps, we can also have a combination of infective sinusitis. An infective sinusitis can occur due to a bacterial infection or a fungal infection. We have simple bacterial infections which are confined to the sinus spaces. When the infections become more pronounced or more troublesome, they can affect the eyeball, they can occasionally go into the brain side, and on rare occasion, they can also affect the nerves of vision. We all have heard about the dangerous black fungus or the mucormycosis, which was quite rampant during the COVID season. A lot of COVID patients developed black fungus or mucormycosis, which was indeed life threatening. Those kind of conditions need emergent care and management. Coming back to nasal septal deviations, once we do a clinical evaluation and also nasal endoscopy, if the nose blocks are persistent, surgery can be a very good option in order to obtain a permanent cure for this problem. In these scenarios, we do a CT scan of the paranasal sinuses. A CT scan is mandatory in the sense that it acts like a road map or a Google map for the surgeon to operate. It tells us about structures that we might not be able to see on endoscopy. It can mark out the critical areas. It can give us details about the junctional area between the nose and the brain, and also any kind of an anatomical variation which prevents us from landing in trouble during the operation. So, before we embark on any nasal surgery, the standard of care involves performing a physical examination, a nasal endoscopy, and the CT scan of the sinuses. So, these things, when done properly, will ensure appropriate outcomes as per the patient's expectation. We have highly advanced high definition cameras and nasal endoscopes which can make the surgeon's job much easier. The visualization during surgery, because nose is a very small corridor, so even a small amount of bleed which can happen during operation can obscure a surgeon's visibility during the operation. So when you have a combination of high definition cameras, good anesthesia, and high quality equipment such as the microdebriders. Microdebriders are commonly called as shavers. They have been a boon in the recent times for the endoscopic sinus surgeon. What the debrider does, that it has an oscillating blade which can cut, suck, and remove tissues in a very precise manner, which has resulted in more precise surgeries, more uh, uh, more predictable results, and favorable outcomes to the patient. In today's world, we also have advancements such as navigation guided endoscopic sinus surgery. What a navigation does, when a surgeon needs some assistance during the operation in terms of identifying a certain critical area, it may be the eyeball, it may be the nerves of vision, it may be the area of the brain. When in doubt, we use what is called as a navigation probe, which can precisely tell us in real time the exact location of the surgeon in the nasal space. So you know that if you're very close to a critical structure, you want to move away from that. Or if you're in a safe space, you might continue the surgery as per plan. Apart from these gadgets, we also have what are called as coablators, high definition bipolar cauteries, and you have more advanced hemostatic mechanisms. We have biodegradable nasal packs, which after the operation, when we keep in the nasal space, they degrade organically over the next 15 days. The patient sometimes may not even have to come back for a follow up if the situation demands accordingly. Along with these, the advent of safe anesthesia and safe anesthesia drugs and techniques, the overall outcome profile and the safety of surgery have increased multifold. Over the last 20 to 30 years, endoscopic sinus surgery has come a long way with advanced gadgetry and instrumentation, which enable the surgeon to reach difficult to access areas. You have sinuses called as the frontal sinus and the sphenoid sinus, which in the yesteryears used to be kind of dreaded by the ENT surgeon. But with the advent of all the advancements in equipments and gadgetry, the surgery in the sinus space, especially in the difficult to reach sinuses, have become more routine, more possible, and more effectively done in the last 2 decades. In essence, when a patient comes with a complaint of nose block, especially which has persisted for more than say 3 weeks, it needs a detailed evaluation. A detailed evaluation comprises of history taking, nasal endoscopic examination, and a CT scan of the nose, and sometimes an MRI scan of the sinuses and the brain when deemed necessary. When we use a combination of investigations in a prudent manner, we are able to diagnose the patient's problem with very high accuracy. This can further tell us whether the patient needs a conservative line of management or a surgical line of management. Usually, unless the sinus problem is not chronic, when we say chronic, it is when the sinus problem has not extended beyond 3 months, we normally attempt to offer them a conservative line of treatment, which in case it fails, then we may have to consider operative solutions to these problems. All in all, nasal septal deviations being one of the most common problems of the nose leading to nose block, if diagnosed and addressed well, it can lead to a significant increase in the quality of life of the patient. I would also like to mention that nasal septal deviation, turbinate enlargement, and also sinus problems can also be the cause of snoring in the adult patients. So, snoring is multifactorial. The blockage of the nose is an important consideration when we treat a patient with snoring or sleep apnea. So, when a patient of snoring comes to us, examination of the nose, the back of the nose, throat, and the voice box are imperative to the final diagnosis, and sinus problems can well contribute to these management of these patients. Also, I would like to tell you that there are certain patients that have chronic headaches. Some of the chronic headaches can be due to sinus obstructions. You can have what is called as a frontal headache. You can have a headache which is persistent over the top of the head or the vertex. They often go undiagnosed, or they may be diagnosed as a migraine headache. Until we dive deep, do some investigations, we may not be able to pick up the real root of these problems. Isolated sinus infections are also being seen in increased numbers in the last 5 years. These also, when treated effectively by the ENT surgeon, can give very gratifying results to the patient. Another more dreaded form of sinus infection is seen in the immunocompromised patients or in diabetics. These set of patients tend to have a low immunity or a low immune status, which predisposes them to more fulminant or more dangerous bacterial and fungal infections. So, when a patient has a known cause for altered immunity, if there is rapid progression of, say, a vision or a cheek swelling or a headache or a swelling or a blackening of the palate, you may want to look at the more fulminant form of sinus infections called as the acute invasive sinusitis. Acute invasive sinusitis usually tends to be fungal, but on occasion, the bacterial infections can also be seen in a dominant form. So, when a patient is in a state of immune compromised due to chemotherapy, radiation, or a cancer therapy, and on occasion due to a diabetes which is uncontrolled, these patients need to be tackled more effectively and perhaps more quickly in order to prevent complications to the surrounding structures. All in all, endoscopic sinus surgery is a science which has evolved leaps and bounds in the last 2 decades, especially after the advent of the first set of endoscopes, which came in the 80s. The last 2 decades have seen drastic improvisations in the field of instrumentation for nasal endoscopy and endoscopic surgery, which have led to more effective and efficient diagnosis and treatment. As an extension of sinoscopy, I would like to tell you that a lot of tumors in the brain can be treated via the endoscopic endonasal routes. What I'm saying is that for the tumors of, for example, the pituitary gland, or the tumors of what we call as the clivus or the craniopharyngiomas. These are the group of tumors which we may be able to treat through the endoscopic endonasal access without having to make a conventional opening in the brain or a craniotomy. As an extension of the science of endoscopic sinus surgery, endoscopic base of skull surgery has evolved in the last decade, leading to treatment of many of the tumors sitting in the base of the brain, in the orbits, on the nerves of vision more effectively through the minimal access route. The patients go home in about 5 to 6 days. There are no scar marks on the head, and the overall recovery has been very fast in comparison to the conventional technique. So, thank you very much for your patient listening. Uh, can we go to the questions now, please? Septoplasty is a routine procedure. The question here is septoplasty is septorhinoplasty a major surgery? Septoplasty means correcting only the wall. Rhinoplasty means correcting the entire framework of the nose. Septoplasty can be done in a endoscopic or a minimally invasive fashion. Rhinoplasty may need what is called as an open approach. Either way, both surgeries are done under general anesthesia. The risk of these surgeries in the regular patient is very low. How long is the septoplasty recovery? Septoplasty patients stay in the hospital for 1 day. They may have nasal packs inside the nose to prevent bleeding for 2 days or 48 hours. Once the packs are out, day 3 onwards, they can get back to their routine activities. By the end of a week, their breathing would have improved when compared to the pre-surgical period. So when we talk about pain, one of the common questions that patient ask is septoplasty very painful? No, it is not painful. Typically, patients that undergo septoplasty have the symptom of a nose block. After the operation as well, since the nose is a very bloody structure, there's a lot of blood circulation which happens inside the nasal cavity and the sinuses. We keep nasal packs called as Merosil packs. They are basically PVA sponges polyvinyl alcohol sponges to prevent bleeding. Septoplasty surgery is not painful. The patients mostly do very well with a basic dose of paracetamol. We don't even escalate to higher pain medication. Is septoplasty better than rhinoplasty? Rhinoplasty is considered along with septoplasty only if there is a cosmetic external nasal deviation, or septoplasty alone will not suffice to establish the breathing effectiveness of the patient. In principle, rhinoplasty entails a cosmetic procedure. Septoplasty is more of a functional procedure or a procedure done in order to improve the breathing of the patient. Rhinoplasty is not offered to all patients commonly. So when a rhinoplasty is done, there are two modalities to offer rhinoplasty. It is called as an open septorhinoplasty, or some surgeons prefer to do the closed septorhinoplasty. Both can be done effectively in experienced hands. The choice would essentially lie with the surgeon after a discussion with the patient. Septoplasty, does the septoplasty leave any scar? No, septoplasty does not leave any scar. It is a scarless, sutureless, minimal access endoscopic procedure. Thank you all very much for your patient listening. It was a pleasure to be on this channel today.